Again, and good morning, and it's been a great few days here in Brazil. This has been a talk people have been asking me about. They're very excited to hear about marijuana. And I'm going to talk about the marijuana for pain control, but really the more important lesson from this talk is some things to learn from us in the United States. We in the United States, we teach many good things for around the world that we export and other countries use. You should not use everything that comes from the United States, so you can learn something not to do from us in the United States from this talk. We have in the United States what's referred to as an opioid epidemic. It's a really big problem in the United States. And it's generally accepted that we, the physicians and the medical community, are the cause of this opioid epidemic. And this opioid epidemic is no small problem. These are overdose deaths in the United States from opioid-related drugs. And you see here, this is all opioids. These are the opioids that we prescribe. Oxycodone, OxyContin. These are other even stronger medical opioids like fentanyl. But these are deaths from these. Now, you see this rise in heroin. That's because right here we started to get more strict with the prescription opioids. We started here to get more strict. The prescription opioids became very expensive on the streets, and heroin's much cheaper. So now you see the deaths from heroin in the United States. Our problem in the United States with drug deaths is massively bigger than the rest of the world. You can see here in the United States our drug-related deaths. And here in your Latin America, South American countries, you're less than a fifth of the deaths from drugs that we have in the United States. And if you're in Eastern Europe, you have even smaller amounts, but this is here, Latin America compared to us in the United States. So it's a huge problem. So how did we create this problem in the medical community? In the 1990s in the United States, the American Pain Society, and it's mostly anesthesiologists, they said that no one should have pain, and that pain should be like blood pressure or a temperature or your pulse, that it should be the fifth vital sign, and that we should measure it all the time in patients to make sure they're not having too much pain. So they popularized this view that patients should never have any pain. If you break your leg, you should never have any pain from breaking your leg. You should not have any discomfort at all. Now, in addition to that, the hospitals started to be rated, to be evaluated on how well they controlled patients' pain. So now, every 2 hours, the nurse has to wake the patient up, is sleeping, say, do you have any pain? Well, yes, I have pain. Okay, here's some opioid medication. So this then, the patients in the United States became very used to opioid pain medications. And to be rated as a good doctor, you had to give these medications, or they say, oh, the doctor didn't control my pain, he's a terrible doctor. So that's how the problem started in the medical community. So there was so much opioid available, it started to become abused. Now, this shows the magnitude of the problem in the United States. These are daily doses of opioids in the United States. Look compared to here in Latin America. You're down here. This is Brazil. So you have 460 daily opioid doses in Brazil compared to us with 47,000 opioid doses a day. So this is a huge problem for us. So we're looking for alternatives, ways to get away from, to manage pain in patients that's less addictive, less problem, less chance of overdose. And one of the things that has come up is potentially marijuana is a useful adjunct for reducing the amount of opioid we use in the United States. Now, marijuana, of course, it's a different drug, but it has a much lower addictive potential than any of the opioids, and it has, no one ever overdosed from marijuana. The worst that happens when you have a lot of marijuana, you eat a bag of Doritos. You know, that's the marijuana overdose. So it's of interest to. Now, it's been around for a long time in the medical community, even with Hippocrates. Hippocrates prescribed marijuana. And some of the most famous doctors in the world introduced marijuana, especially for managing migraines. Sir William Osler, one of the most prominent medical doctors in the world, wrote and recommended marijuana for the treatment of migraines in the Principles and Practice of Medicine, which was the most prominent textbook of the time. Until the 1930s, it was available in American pharmacies. And it was widely used in the African communities and in immigrant communities. So it had a stigma associated with it because it was used by the lower classes. It was cheap, and so the upper classes banned marijuana in the United States in 37. And since that time, it's had a stigma associated with it until recent days. Now, there is some literature that says that marijuana may be able to reduce opioid use, although research in marijuana has been very difficult to do because of the stigma associated with it. If you want to do a study in marijuana in the United States, it's classified. Marijuana is classified in the same drug class as heroin. So you have so many restrictions on what you can use to study marijuana that it became impossible to really do much research on it. So there's not a lot of research. But there is some evidence, a circumstantial evidence that marijuana can be helpful in reducing opioid-related problems. So this shows states that don't allow marijuana, and these are states that allow medical marijuana, and you're looking at opioid deaths. So there's less opioid deaths in the states that allow marijuana. Now, as I said, the associated stigma makes it difficult to do the research, but there is some evidence that it's good for pain, but the studies are small and inconclusive. Now, a lot of this may make no difference at all because this is rapidly becoming legal in the United States. So here in the United States, these dark green places, my current state, my former state in Massachusetts, marijuana is legal for recreational use in these states. So you can go to it's just like buying alcohol in California and Massachusetts and all these other states. These states, not legal at all. These light green states, it's legal for medical use. So in 29 states, it's legal for medical use. And in 9 states, it's legal for recreational use. But there's a lot of controversy federally because it's still not legal on across the country on a federal level. And if you look here, this is the map of the United States, the Democrat and Republican, and you can see who's against marijuana and who's for marijuana. It almost breaks down along those lines, and that's why it's a very controversial issue. Now, here's this store is 2 blocks from my house in LA. This is a marijuana store. Very nice, very clinical. This is not medical marijuana. This is straight up marijuana. Go in and see what you like, what kind you want. Do you want some to make you laugh? Do you want some to make you sleep? They have marijuana experts in these stores, and they tell you everything you need to know about the marijuana. Now, a few years ago, when I was in Boston, and it was right when marijuana became legal in Massachusetts, we noticed anecdotally on our service that some of our patients were taking less opioids than we expected them to. We had a patient with a calcaneus fracture, said, no, I don't need any pain medicine. And we said, why you don't need any pain medicine? And he says, well, I just use marijuana, it's okay. And I had a patient, my own patient with a total hip who had never, she was wanting, give me some narcotic, give me opioid. And I said, no, you can't have it. And she was a good patient, no problem. I said, you got to stop this. So she said, and she came back to see me. And I said, how is the pain? And she says, oh, it's really good. A friend gave me some marijuana. She says, I haven't had any since I was in college, but she said it took care of all the pain. I don't need any pain. So we got interested in it on the trauma service, and we wanted to do some research on it. We called ourselves the Green Service. So initially we thought you could just write a prescription. We said, it's past the law, you just write a prescription. So we would write prescriptions that said, 3 marijuana cigarettes a day. Turns out it was much more complicated than that. You had to apply for license and da-da-da. So we didn't do that, and we couldn't do the research we wanted to do. But we decided to do a survey study of our patients to see what they thought about marijuana, and this was recently published in JOT. So we wanted to know what our patients thought about marijuana and if they really believed it could be useful as a medicine, and if they thought it could be useful in treating acute pain. And we wanted to see if they used it at all, and did it help. And we looked at 500 patients. We gave 500 patients this survey, or 500 patients completed it. And in addition to the questions about marijuana, we asked them to take a measure of anxiety, a measure of pain catastrophizing, and a measure of post-traumatic stress disorder. Now, 81% of our patients really believed that marijuana was something that can be used for medical purposes. 12% unsure, 7% thought it was just bogus, it was no good as a medication. 78% thought it would be good for pain, and 62% thought it would be good for anxiety. Now, the very old patients were the least likely to think it would be useful. However, even most old patients thought it would be useful. 81% of the patients thought it was useful as a medicine. 60% of the patients, 60% of this 500, had tried marijuana at some point in their life. 21% had used marijuana in the last year. And 13% of these 500 patients used marijuana in their recovery. And when you ask these patients that used marijuana in their recovery, they said, was it good? Did it help you during your recovery? And 90% believed it reduced their pain. And 81% thought it really allowed them to take less of the narcotics, less of the opioids that we didn't want them to take. The patients that did use marijuana during the recovery, they did have higher anxiety, but they had no higher incidence of post-traumatic stress disorder and no increase in catastrophizing. But this is what we really were interested in. Did this really help patients not take opioids? So we went back in this 500 patients. We have a medical drug database. We could go in and look and see how many of these patients were actually using opioids. So we saw how many patients were persistently using opioids, what was the total dose of opioids that were prescribed, and the duration of the opioid use. Now, this study isn't published yet, but unfortunately for all those who believe marijuana is a great thing, we actually saw that during the recovery, the patients that said they used marijuana used more opioids, not less. Even though they thought they used less, they used more. And they used them longer than our patients who did not use marijuana. So for the big marijuana people, it wasn't the best news, we found out. So the big thing I hope you take away from this is avoid this terrible path that we went down with prescribing opioids. If your pain doctors try to get you to say we need to control pain, send them to a different country. Send them to Argentina or something. Marijuana may be useful. A lot of people think it's useful, but it doesn't. It's not a substitute for opioids. It's a different method of controlling pain. We need better evidence. The big problem we have is social stigma that makes the study of it difficult, but it may not make any difference at all, because I think very soon in the United States it's going to be legal most places. It's going very quickly now to become legal in the United States. So when you visit the United States now, you can come to California and go down the street from my house and you can buy whatever kind of marijuana you want. So thank you very much.